If you think high blood pressure is just a small problem, you are dangerously wrong. Because high blood pressure is not a simple number. It is not just a little stress. It is not just a sign that you are getting older. A high blood pressure is a silent condition. It grows inside your body. It damages your arteries without making a sound. And here is the scary truth. Many people feel fine and still have damaged blood vessels. They think, I'm okay. My medicine works. My doctor is happy. But the real danger is not the number on the monitor. The real danger is what is happening inside your body where you cannot see. And when the damage becomes severe, it does not give you a warning. It strikes suddenly. A stroke, a heart attack, kidney failure, or a sudden collapse. That's why high blood pressure is called the silent killer. It kills quietly, and it often surprises people who thought they were safe. Now, I'm not here to scare you. I'm here to tell you the truth. Because the more you understand what is really happening inside your body, the more you can protect yourself. And today, I will explain this in a simple way. No medical confusion, no fake promises, just clear facts. Before we start, subscribe to Flex Health for more simple and real health tips. If you have high blood pressure or know someone who does, watch carefully. Because this information could change the way you protect your health. Myth 1. Salt is the main cause of high blood pressure. Yes, salt can raise blood pressure, but salt is not the main reason for most people. Here's the real situation. Why salt is not the only cause. Your body has a system to balance salt. The kidneys control it. If your kidneys are working normally, they remove extra salt. But if your body is producing too much insulin, common in many people, the kidneys hold salt even if you eat little salt. So your blood pressure can stay high even with low salt. Real reason behind this: many people have insulin resistance. This means the body produces more insulin than normal. High insulin causes salt retention, water retention, higher blood volume, higher blood pressure. So salt matters. But the real cause is often insulin and kidney response. Myth 2. High blood pressure is only a blood volume problem. This is the most common misunderstanding. And people think more water, more pressure. But the truth is, blood pressure is about vessel quality. Your blood vessels are not just pipes. They are living tissues. They need flexibility. When blood vessels become stiff, pressure increases even if blood volume is normal. What makes vessels stiff? Aging, high blood sugar, inflammation, oxidative stress, lack of exercise, poor diet. These factors damage the inside layer of the vessels. When the inside layer is damaged, the vessel cannot relax properly. This increases blood pressure, so blood volume is not the whole problem. Myth 3. If your blood pressure is controlled, you are safe. This is dangerous thinking. Because blood pressure numbers are not the whole picture. Your numbers may look good, but your arteries can still be damaged. Many people take medicine for years and still develop heart disease. Why this happens? Blood pressure medicine controls the number, but it does not always. Improve vessel flexibility, reduce inflammation, protect the lining of the arteries so the risk can still be present. That's why some people have heart attacks even with controlled numbers. Myth 4. High blood pressure is only genetic. Genetics plays a role, yes, but lifestyle has a bigger impact. Real truth: many people with family history still maintain normal blood pressure through healthy diet, daily movement, good sleep, stress control. Genetics may increase risk, but it does not guarantee high blood pressure. Myth 5. A high blood pressure always causes symptoms. This is one of the biggest myths. Many people think, if I feel fine, my blood pressure is fine. But high blood pressure is silent. Most people have no symptoms even when blood pressure is dangerously high. They may feel normal. Symptoms usually appear only when the damage becomes severe. That's why regular monitoring is essential. Let's be clear. A high blood pressure is not just about salt or water. It is about blood vessel health, artery stiffness, inflammation, insulin resistance. Lifestyle medication helps, but it may not heal the underlying damage. That's why we need a better understanding, not to replace medicine, but to support the body. Let's talk about the real reasons behind high blood pressure. Because the truth is, high blood pressure is not only about salt or stress. It is about what is happening inside your blood vessels. Cause 1. Arteries become stiff. Main reason, think of your blood vessels like soft rubber tubes. When you are young, they are flexible. They expand and relax easily. But as we age or because of unhealthy lifestyle, these tubes become hard. Why does this happen? Because the inner layer of the artery gets damaged over time. This damage happens slowly. At first, you don't feel anything, but the artery slowly becomes less flexible. What happens when arteries are stiff? When arteries are stiff, your heart has to push harder. This increases blood pressure. So even if you don't feel anything, your heart is working like a machine under heavy load. Cause 2. High blood sugar damages vessels. Many people think diabetes is separate from blood pressure, but they are connected. How sugar affects blood pressure. When you eat too much sugar or carbs, your blood sugar spikes. This causes inflammation. Inflammation damages the lining of the arteries. Once the lining is damaged, the arteries become stiff. This leads to high blood pressure. Real-life example, imagine a road full of potholes. Cars can still pass, but the road becomes rough and slow. Similarly, damaged arteries become rough and narrow. Blood pressure increases. Cause 3. If insulin resistance, this is one of the most important causes that people don't know. What is insulin resistance? It means your body needs more insulin to control sugar. This happens when you eat too much sugar for a long time. Why insulin resistance increases blood pressure? High insulin causes the kidneys to keep salt and water. This increases blood volume. More volume, higher pressure. This is why many people have high blood pressure even when they eat less salt. Cause 4. Stress and nervous system. Stress is not only mental, it affects the body too. When you are stressed, your body releases stress hormones. These hormones make the heart beat faster, tighten blood vessels, raise blood pressure. If stress continues daily, blood pressure stays high. This is common in seniors who are worried about health, money, or family. Cause 5. Poor sleep. Sleep is not just rest. It is a healing time for the body. When you don't sleep well, blood pressure stays high, stress hormones stay high, inflammation increases, so poor sleep is a real cause of high blood pressure. Real patient example, let me tell you a story. Mrs. Fatima, 58 years old. She used to think, I am fine, I don't feel anything. She ate home food, but she used a lot of sugar in tea. She slept late, she never walked. Her blood pressure was slightly high, but she ignored it. One day she felt sudden weakness in her arm. Doctors said it was a mini stroke. She was shocked because she never felt sick. This is the reality. High blood pressure doesn't always show symptoms. It can quietly damage your brain and heart. Let's summarize in simple words. A high blood pressure happens because 1. Arteries become stiff. 2. Sugar and inflammation damage vessels. 3. Insulin resistance increases salt and water. 4. Stress keeps the body in fight mode. 5. A poor sleep prevents healing. Very important note, this is not a reason to panic. This is a reason to act. Because the good news is you can slow down artery damage, you can improve your lifestyle, you can reduce risk. Now we move to the most important part. What can you actually do to protect yourself? I'm going to give you simple steps that are realistic for seniors. These steps are not magic, but they work when you follow them consistently. Step 1. Move your body daily. The easiest medicine. You don't need expensive equipment. You don't need a gym, just walk. Why walking works so well? It helps blood vessels stay flexible, it reduces blood pressure naturally, it improves blood sugar, it reduces stress, it improves sleep. Simple plan. Walk 20 minutes daily. If you can't walk 20 minutes, start with 5 minutes, slowly increase every week. Important. Consistency is the key. Even slow walking daily is better than fast walking once a week. Step 2. Eat the foods that heal blood vessels. High blood pressure is mostly caused by inflammation and artery damage. So you need foods that reduce inflammation. Eat more of these. Vegetables, fruits, whole grains like oats, brown rice, lentils, nuts, small amount yogurt. If you tolerate it, avoid these. Sugary drinks, fried food, processed snacks, too much white bread or white rice. Simple daily plate rule. A half of your plate should be vegetables. The rest should be protein and grains. This is enough. No strict diet needed. Step 3. Reduce sugar. Hidden killer. Sugar is one of the biggest hidden causes of high blood pressure. Many seniors drink sweet tea every day. This small sugar adds up. What sugar does? Damages blood vessels, increases insulin, increases blood pressure, increases weight. Simple sugar rule. No sweets after dinner, no sweet tea every day. Replace sugary drinks with water or unsweet tea. You don't need to stop sugar completely. Just reduce it. Even 30% reduction can make a big difference. Step 4. Control stress. Stress is not just a feeling. It affects your body. When you are stressed, your heart beats faster, blood vessels tighten, blood pressure rises. Simple stress control methods. Deep breathing for 3 minutes daily. Walk after lunch. Listen to calm music. Talk to someone you trust. Even 5 minutes of calm can reduce blood pressure. Step 5. Sleep. Your body repairs at night. Poor sleep is a major cause of high blood pressure. If you sleep late or wake up often, your blood pressure stays high. Sleep tips. Sleep at the same time every night. Avoid phone 30 minutes before bed. Avoid heavy food late at night. Keep room dark and calm. If you sleep well, your body repairs the blood vessels. Step 6. Weight and belly fat. Most important for seniors. If you have belly fat, your risk increases. Belly fat creates inflammation. It increases insulin resistance. It increases blood pressure. Simple rule is if you reduce even 5 kg, your blood pressure can drop. How to reduce belly fat? Walk daily, reduce sugar, eat more vegetables, avoid fried food. Step 7. And check BP correctly. Most people do it wrong. Many people measure blood pressure incorrectly. Correct method. 1. Sit and rest for 5 minutes. 2. Keep your feet flat. 3. Don't measure after walking or eating. 4. Use the same arm. 5. Measure 2 times 6. Note the average best time to measure, morning, evening. This gives the real picture. Step 8. Medicine and doctor. This is very important. Do not stop medicine. Medicine controls the number. It is not a weakness. It is protection. Talk to your doctor if your BP is high. Consult your doctor. Tell them your diet, sleep, stress, sugar levels. Your doctor will guide you correctly. High blood pressure is not a curse. It is a warning sign. Your body is telling you, please slow down, please protect me, please care for your heart. You don't need a miracle, you just need small, consistent steps. Start today. Before we finish, I want to make one important statement. This video is for education only. It is not medical advice. If you have high blood pressure, diabetes, kidney problems, or heart disease, you must consult your doctor. Do not stop or change your medicine without your doctor's approval. If you feel chest pain, shortness of breath, severe headache, dizziness, weakness in one side, seek medical help immediately. This is not a normal sign. It can be serious. Here are the most important actions you can take today. Walk 20 minutes daily, reduce sugar, eat more vegetables, sleep better, measure BP, correctly consult your doctor regularly. These steps protect your heart and brain. If you found this video helpful, please like it. Share it with your family and friends. High blood pressure is common, but it is not normal. It can be managed and controlled with the right habits. You are not alone in this. Subscribe to the channel for more senior health tips. Thank you for watching. Take care of your health. Stay safe. Today can protect your tomorrow. Don't miss the next video. Subscribe now and stay safe.